you can see the slides and you can also hear me. Try to keep the background noise to a minimum if possible. These are the 4 things that I want to talk about today. The first one is definitions of e-cig and e-cigs, and also learning some of the lingo, which is actually super fascinating. Talk about specifically e-cig epidemiology in our MAT patients, including methadone and buprenorphine. That's where most of the data is. I did not see any articles about e-cigs in people that use Vivitrol. So then I'll spend a few minutes talking about vaping-associated injury and death. And then finally, and what I hope to do is have a discussion with you all about, do you think that vaping and e-cigarettes is like the new gateway drug, or is it actually something that's going to help a lot of our patients quit smoking? So it's hopefully it'll be interesting discussion. All right, so let's start with e-cigarettes. What's the definition? So basically, e-cigarettes are battery-powered devices that are used to deliver a nicotine-containing aerosol. So every e-cigarette has 3 parts. It has a battery, it has an atomizer, which is the heating element, and it has some sort of e-liquid, which they sometimes call e-juice. And so the e-liquid is a solution of either vegetable glycerin and or propylene glycol. So they call that VG and PG, and it's that liquid that contains the nicotine and the flavorants. And so this chart comes directly out of the American Society of Addiction Medicine 6th edition of the book, chapter 20. And for the first time ever that I can remember, the ASAM book actually has an entire chapter that's devoted to e-cigarettes. And so the first thing you need to know is that the e-cigarettes come in different forms. And there's 1st generation, 2nd generation, and 3rd generation e-cigarettes. The 1st generation is what they call the cigalikes. So they look just like a cigarette, and they have very low battery. So it's a very small battery, and the 75 to 150 mAh is milliamp hours. And so that represents how much total charge the battery has. So the 1st generation one comes with a cartridge and an atomizer. It's either disposable or rechargeable, and the way that you activate it is when you puff on it. The 2nd generation e-cigarette is a pen style tank e-cigarette. It's bigger, it has a bigger charge. It's got a pre-built coil in it, and it has either a pre-filled cartridge, and then once that's empty you can refill it, and there's an actual little on-off switch, so there's a manual switch on it. And then the 3rd generation is called the Advanced Personal Vaporizer. There's lots of different shapes and sizes, and as you can see, it's like triple the charge of the 2nd generation one, so up to 3,500 milliamp hours. And then they call they have different names, like the mechanical mod or the regulated mod, so that's the way they call the coils. And it is compatible with most standard tanks, and this has a little button that you press. So if you want to look at it in terms of a picture form, the 1st generation one, as you can see, looks just like a cigarette, and then they've kind of morphed over the years, and I didn't even realize there was a 4th generation one, which apparently is, as you can see on the slide, light years ahead of the earliest devices. So lots of technology going on here. And but yeah, the ones that my patients typically have are the 3rd generation or the 4th generation ones. So those are the ones that they carry sometimes into my office, as they like to vape during their appointments. So that's always fun. Okay, the next set of lingo that I want you to be aware of is something called vape mod versus pod mod. Okay, so what is all that? So a vape mod is a refillable tank. It's got the customizable coils. This is for your aficionados or your enthusiasts, and they have nicknames. They're called cloud chasers or tricksters. And so these are people that like to tinker with their vape, and they like to improve the performance of their vaporizer, and they like to, have all kinds of weird attachments and stuff like that. So that's the vape mod group of people. And the pod mod group of people are people that are using a closed system where the vape juice is stored in a disposable pod. And this set of people, or this set of devices, is very popular with people that want something very simple and easy to use. And for example, former smokers. And so the pod mod people, or the pod mod devices, are what you guys might recognize as Juuls. J-U-U-L is the name of the product. And so when you use this Juul, it's called juuling. And so one of my patients actually on Wednesday, she had her jewel with her, and I said, "Hey, can I see that?" So she let me sort of open up the cap and take a close look at it because I had never actually touched a jewel prior to Wednesday morning. And so apparently there's a lot of jewel look-alike. There's rubies and fixes and my lays and my blues and Mark 10 elites. So there's all kinds of things that are like these pod mod things. And so when my patient, I said, "Well, how much nicotine do you use?" She goes, "Oh, I use like 1 to 1.5 pods a day." So I was like, all right, I have zero idea what that means. So thank God for the internet, because now I understand that what's in a single jewel pod is 1 to 2 packs of cigarettes. So somewhere between 20 and 40 cigarettes is equal to 1 jewel pod. And what's interesting about this, and this is my own little quote that I was thinking about today, but you guys might remember the song "Smoking in the Boys' Room." I can't remember the band that sings "Smoking in the Boys' Room," but now I say it's called "Juuling in the Girls' Room." So everybody's doing it. They're doing it in high schools. They're getting caught for it and stuff like that. So I don't know if you can see the arrow. Here's the little cartridge right here. And what's scary on this slide, it says, is that these prepackaged pods come in flavors like mango and creme brulee. So that's pretty scary. The entire device looks like a flash drive. So a lot of high school teachers think that their students are just plugging a flash drive into the computer, when in fact what they're doing is charging their thing up. And then if you look at the trends, so in gray, right, in 2011, the percentage of high schoolers who was smoking in the past month was 16%, and that had dropped by 2017 down to 2%, whereas in 2017, there was 8% of high schoolers smoking, but 12% of them vaping. So this is a pretty scary slide in my book. Oh wait, I gotta get it back onto the slides here, I hope. Oh yes. Okay, so the next set of terminology that I want you to be aware of is freebase versus nic salt. So I also had never heard of this until I started looking into this. So when you take your freebase nicotine, hang on a second, I gotta check something here. Oh, Motley, sorry, Motley Crew, thank you. Okay, I was checking. When you take your freebase nicotine, which is what you have in regular cigarettes, and you treat it with benzoic acid, you turn it into a nicotine salt. Okay, so that's step one. And then what happens, and this is very interesting in terms of like corporate America. So Philip Morris now has some competition from Pax Labs, because Pax Labs is the creators of the Juul, right? So what's interesting is that Philip Morris stripped away the naturally occurring nicotine salts in leaf tobacco, and they used ammonia to create freebase nicotine. Oops, I see I was repeating myself there. I got to change those slides. Sorry. So Philip Morris created freebase nicotine, and then in 2015, Pax Labs basically turned the strategy upside down, and they took Philip Morris's freebase nicotine, and then they added the benzoic acid to create nicotine salt. And what is fascinating to me about the benzoic acid is that three things happen when you add the benzoic acid. First of all, you decrease the alkalinity, which then allows manufacturers to increase the nicotine level in the nic salts. Secondly, the nic salts cross the blood-brain barrier faster than freebase nicotine. And since I've never smoked, I don't know what that means, but they said it causes a smoother throat hit. Okay. And then finally, the nicotine salt e-juices can be vaped at a lower temperature. And the reason that is fascinating is now you can have cheaper and less powerful devices back in the vaping game again. So all that stuff to say that the nic salt, or the nicotine salt juice, looks more like a regular cigarette, which is the black line. So this is the nicotine salt, the stuff with the benzoic acid, and then this is the freebase stuff, which is, you can see you get very little nicotine levels in your blood, whereas if you have the nicotine salt, the levels are almost exactly like a regular burnable cigarette. So that's also very notable. And then I started to find these words, dripping and dabbing. So I thought dabbing was like a dance that 10-year-old boys did, but clearly it's other things as well. So dripping, which refers mostly to nicotine, is when your adolescent modifies their e-cigarette. And what they do is they drip the juice right onto the coil to increase the hit of nicotine that they get. And when they surveyed kids, a quarter of them had engaged in dripping. So a lot of adolescents know about it. And the manufacturers were reportedly making their coils more accessible, which would enable the teenagers to be able to do this more easily. And then dabbing is a whole nother science altogether. Dabbing usually refers to THC. And so this little glass thing is called your dab rig. It's like a mini hookah. So it's a water-filled device through which the user inhales the vapor. And then affixed to the rig is this thing called a domeless nail. You actually have to have a little blowtorch. So you heat the domeless nail with a blowtorch until it's red hot. So that right there sounds a little dangerous to me. You wait 20 to 40 seconds. Then you take a little bit of this stuff, which is the marijuana wax, and sometimes they call it shatter. So you take the wax or the shatter and touch the wax to the nail that's red hot, and then that produces the vapor, and then you inhale it through the rig. So that's what dabbing is, and it's a little bit different than dripping. All right, so what does this have to do with MAT patients? Well, there's been 2 papers and probably several others, but these were the 2 I thought were the most interesting. There was a 2015 paper that I found and a 2019 paper that I found, and they wanted to know a little bit about the epidemiology of e-cigarettes in medication-assisted treatment patients. So the one that Stein did in 2015 took 315 opioid-dependent smokers. They had 164 patients that were on methadone, and there was 151 patients that they had on buprenorphine, and all of these patients were treated in the same health system in Massachusetts. The sample was about 50% male, and it was about 85% Caucasian. And if you can see here that, almost 100% of them had heard of e-cigarettes. Almost 3/4 of them had ever tried e-cigarettes, and 33.8% of them had used e-cigarettes in the last 30 days. And all of those numbers are higher than the general population. The most common reason that the folks in this program used e-cigarettes were curiosity at 41%, and to quit all nicotine at 26%. And so the proportion of the opioid-dependent smokers that had ever tried e-cigarettes and used them in the past month was actually, well, that's what I was saying earlier, it was just substantially greater than that found in recent general population surveys. And then the other article is the 2019 Baldessari paper, and they looked at, this was also East Coast, so this was Connecticut, in a center that was associated with Yale. And there were 782 patients that were entering treatment for opiate use disorder. So I don't think they gave the exact numbers, but some of them were going to get methadone and some of them were going to get buprenorphine. And of the folks that they surveyed there, 6% of them were already daily e-cigarette users. 18% of them reported that they had used in the last 30 days, and 62% of them reported ever using an electronic cigarette. And then interestingly, which the last study did not look at, but this study also showed that 85% of those people, those 782 people, reported current cigarette smoking, and 46% of those surveyed said that they were using e-cigarettes to quit or cut down on their smoking. And so when they did some of the multiple regressions, they found that daily e-cigarette use was associated with higher odds of being a former smoker, whereas e-cigarette use in the past 30 days was associated with a couple of things: higher odds of being non-Caucasian, higher odds of reporting psychiatric distress, and a history of chronic pain. So their survey questions were a little bit different than the 2015 survey questions. And the conclusion from this particular study was that interventions, so actually using e-cigarettes to help people reduce the harm and the mortality associated with smoking, they were saying maybe we have to look at it this way. So that was interesting end of their discussion. So I'm going to sort of switch gears a little bit just because this has been in the news so much. So as of 3 days ago, the 7th person died of a vaping-related illness. and this person died in California. And then you can see the other states in which other, other people have died. And then as of 9/11, the CDC researchers reported 380 confirmed and probable cases of lung illness associated with e-cigarettes in almost everywhere in the country, so 36 states, as well as the US Virgin Islands. So the next couple of slides, this is a August 30th, 2019 definition that the CDC uses to define a confirmed case of this vaping injury versus a probable case. So the confirmed case, basically you have to have used an e-cigarette, or you have to have dabbed in the 90 days before your symptoms started. You have to have a, pulmonary infiltrate on your x-ray or chest CT, and you are not, you are not supposed to have any sort of pulmonary infection. So basically it's a diagnosis of exclusion. So once you've ruled out about 100 other things and you have no evidence that there's anything cardiac, rheumatologic, or cancerous going on, then you can call it a confirmed case. And you'll see the difference is that with a probable case, you've got the history of the vaping or the dabbing, you've got the bad looking chest CT or the bad looking x-ray, but in these cases, you actually have identified an infection, but the clinical team that's taking care of the patient believes that this is not the sole cause of the person's pulmonary process. So in those cases, they call it a probable case. Okay, so those are some CDC definitions. So the pulmonologists very cleverly have already come up with a name for this illness, and it sounds just like vaping because they call it vapey or vapi. I don't know exactly how to pronounce it, but that stands for vaping-associated pulmonary injury. Most of these are young men, so they are 20-year-old, male predominance. 80% of them are not vaping with nicotine. They are vaping with THC. Almost 100% of them reported vaping within the last week. What's scary to me is that a third of the cases, they're initially diagnosed with a mild pneumonia, and then they're discharged home with oral antibiotics. And then somewhere between like 2 to 8 days later, so the median is 6 days, they start to really deteriorate. And the last article, or the best article, I guess, that was published on the topic is the Leiden article in 2019, and you can see the presenting symptoms. So respiratory symptoms, GI symptoms, constitutional symptoms, and interestingly, 40% of them had a headache, but upper respiratory symptoms don't seem to be a component of the illness. So that's basically what it looks like. The article also went into a little bit about what's the cause or what's the pathophysiology, and they said that most of the cases represent something called lipoid pneumonia, and that's possibly related to vaping cannabis oil. So lipoid sort of refers to like fat, like substance. And then they said, this is where it got way over my head. They said, well, it's not all lipoid pneumonia. It could be cryptogenic organizing pneumonia. So it's like, okay, don't ask me what that is. The other thing I found interesting was that vitamin E has recently started to be used as a liquid carrier of THC in some of the vapes. And so they think that vitamin E somehow is like a chemical culprit in the cases, in addition to the oil that's associated with the cannabis. So there's certainly lots more research that has to be done. So I think this is my last slide before the references, but basically the discussion that I'd like to have, and the discussion that is raging on right now on the internet and in the research circles is, so e-cigarettes, are they good or evil? Are they the next gateway drug or device for our kids? Is this a way to quit smoking regular cigarettes, especially in our opiate addicts? Or is this a new way to get high on marijuana or whatever other drug you would like to dab? So it's just a huge, wide open topic. And like I said, I'm just giving you a little bit of an appetizer, so to speak. So my references, I left you the 3 articles, the Baldessari article, the Leiden article, and then the Stein article. And I tried on every slide to show you the website that I got the information from, so you can go back and look at it in more detail. And I'm going to shut up now and mute myself so I can hear you guys.
Thank you so much, Chris. I learned a lot. I also learned that you were not listening to Motley Crue smoking cigarettes in junior high school. So, but I learned a lot of other things too. So first of all, I saw Dr. Belosh, and there's some other things that people put up there, but what questions do people have? And then we'll entertain some of those questions that Chris had for us to consider. So Dr. Belosh, I guess, first of all, do you want to mention what you put up there?
Sure. I'd actually heard from some patients that they had been using these vape pens and vaporizers for other substances as well. So cocaine, heroin, fentanyl can also be mixed into the oils and used through these vapes. So this article actually talks about like the percentage of individuals who've done that as well. So I thought I'd share that.
Yeah, I think Dr. Ballister brought that up a couple of weeks ago, that a patient of his had mentioned using some opioid via a vaping or some type of mechanism like that. One other question, Dr. Belosh, with your patients, are they buying so when are they putting in the drug themselves, or are they buying I don't even know how to say it, are they buying the vape with the substance already in there?
From what I know, they're doing it themselves.
Okay.
You can refill the cartridges, and so they get pretty creative, and they've done different experiments on whatever they've wanted to try, from what I've heard.
Gotcha.
Yeah, and then one thing I'll add is I've also come across some really interesting things just looking up what patients have told me. There's watches that look like iWatches that are actually vapes, and then there's iPhone covers that are actually vapes as well. So pretty sneaky to sneak around with you in class and whatnot.
So we got the Whizzinator from the AM, and now we got the vape watch. It's like Get Smart or whatever that show was. Dr. Ballister, what were you gonna say?
Yeah, well, actually, my patient denied having any relapse, and it was on the saliva toxicology that was coming up, fentanyl and other things, and she was getting the jewel plug refilled by a friend.
Yeah.
Okay, and then after she stopped, vaping those homemade juices, her toxicology has been negative.
Gotcha.
There was a case report, I think in 2017, of somebody that died because they tried to vape fentanyl.
Oof.
And then on the links I put in, that inverse article, apparently that vitamin E thing was like trying to dupe the customers, thinking that they were getting marijuana oil. Okay, and that vitamin E acetate is very toxic. The lipoid pneumonia.